What is Create Kids and what are the aims of the study?
Create Kids is a sub-study of a larger project which is called CREACTIVE, which is one of the two European consortium belonging to the NBIR. NBIR is the International Initiative for Traumatic Research for research in traumatic brain injury. And CREACTIVE is a special sub-study devoted to kids who suffered from traumatic brain injury. And we have several goals, honestly. One of the main important is to develop new models for prognostication of these patients, these little patients, to use for many different purposes. From identify the centers of excellence in treating these patients, because we have to learn from the excellence to teach to all the other. We use this model for identify the most effective treatment, in a comparative effectiveness research perspective, and many other aims that needs a reliable prognostication of these patients.
Do we have preliminary results?
Yeah, we are finalizing our analysis. We have several different preliminary results. First of all, we are realizing that the outcome measures for this kind of patients should be rethought, because right now we are using tools which are too simplistic for the complex situation of this patient and the multidimensional outcome that we have to treat. So we have developed a toolkit, very useful, very easy to be used, which will be, we hope, one of the standard for the assessment of the outcome of these patients at 6 months and 5 years after the trauma. It's very important to assess the outcome far from the initial insult, the initial injury, because especially for kids, the outcome is something which progresses over time, and so we cannot be happy about the results collected at 6 months, as we are used to see right now. We have to prolong the follow-up to be sure what is the effect of our treatment. Then we also are comparing the care and the outcome between different centers, those devoted to kids and those who are principally organized for giving assistance to adults, which are treating also children with TBI. This is something which still happened, not only in Italy, but in many other countries. Create Kids collect data from 7 countries in Europe, and we see that there is a lot of variability between these countries, and the organization of care is very, very important for these patients. So the centralization is an issue that we are dealing with in the study.